Hello everyone, my name is Andres Rangel and today I will be presenting my infomercial on the topic of nicotine. Before I explain what nicotine is, first I want to give you a background of where nicotine comes from and how it was used in previous cultures. Nicotine was discovered in 1828. It can be found in tobacco plants as the one pictured below. Nicotine was originally introduced by Columbus in 1492 when receiving tobacco plants from natives of San Salvador. However, natives have been smoking tobacco long before he arrived. Other people that consumed nicotine through tobacco plants long before Columbus included those of the Aztec and Mayan cultures, mainly for ceremonial purposes. And so, what is nicotine? Well, it's an alkaloid, meaning any class of nitrogenous organic compounds of plant origin which have pronounced physiological actions on humans, which in this case, nicotine is derived from the tobacco plant. Nicotine is a substance that can cause both addiction and dependence and can be found in various tobacco products, including smoked tobacco products such as cigarettes, cigars and pipes, clove cigarettes, hookahs, and water pipes, and it can also be found in smokeless tobacco products such as chewing tobacco, snuff, dip, snus, and dissolvable products. And most recently, it's been used in the form of vaping and electronic cigarettes such as e-cigs and jewels. What are the effects of nicotine on the body? Well, nicotine's effects on the body can produce an intense effect on the central nervous system, including activating the brain's circuitry regions that are responsible for managing feelings of pleasure, specifically the neurotransmitter dopamine, which is why abuse potential for nicotine is very high. Also, some of the acute effects include a rapid increase in brain concentration. Nicotine also increases respiration rates at low doses by stimulating the carotid artery, which is responsible for monitoring the brain's need for oxygen. Additionally, it also stimulates cardiovascular system by releasing epinephrine, which controls blood flow, heart rate, and blood pressure. Nicotine stimulates salivary and bronchial secretions and then inhibits them shortly after. Some of the risks associated with nicotine use include developing nicotine dependence and addiction, which is due to the fact that nicotine is one of the most addicting substances, which has been found to be as addictive as cocaine and heroin. Another risk is exposing and contributing to the deaths of other people through secondhand smoke by increasing chances for them to develop diseases such as cancer, heart disease, stroke, lung diseases, diabetes, and chronic obstructive pulmonary disease, which includes emphysema and bronchitis. Additionally, secondhand smoke also puts children at an increased risk of developing illnesses such as sudden infant death syndrome, acute respiratory infections, middle ear disease, severe asthma, respiratory symptoms, and slow lung growth. Lastly, nicotine use increases the chances of nicotine poisoning with heavy use. Some of the consequences associated with nicotine use include developing cardiovascular diseases such as heart disease, artery disease, and hardening of the arterial walls, which can lead to a heart attack. Another consequence of nicotine use is an increase in adrenaline, which can increase blood pressure, increase heart rate, and increase breathing, which is dangerous to people who are suffering from cardiovascular diseases. Also, one consequence of nicotine use through tobacco consumption, as mentioned earlier, can cause nicotine poisoning, which can lead to respiratory failure due to breathing difficulty and even death. Lastly, one major consequence of nicotine use through tobacco consumption is the development of cancers, which include cancers of the mouth, pharynx, larynx, esophagus, stomach, pancreas, cervix, kidney, uterus, bladder, and bone marrow. Some of the treatments for nicotine dependence include nicotine replacement therapy, which works by stimulating the brain receptors targeted by nicotine, helping relieve nicotine withdrawal symptoms and cravings that lead to relapse with over the counter products like nicotine patches, gums, and sprays. Prescribed medications like bupropion and varenicline also reduce nicotine cravings by simulating similar effects. Also, cognitive behavioral therapy has shown to be effective by helping patients identify triggers like people, places, and things that spur behavior and teach them prevention skills. Also, telephone support and quit lines, which are a part of tobacco control efforts, and all states offer toll free telephone numbers or quit lines with smoking cessation counselors who provide information and support. This concludes my presentation. Thank you for listening.